When COVID-19 broke out in China and started going round, we at the Ministry of Health, we were charged by Minister Hanire to start to think about what will happen if this comes to our shores. And one of the things we did at NIPRID was we very quickly identified some of the areas where there were gaps. So we had realized that when this hit places like Europe and America, very quickly things like sanitizers, things like face masks and other relevant commodities, the supply chain for these products were disrupted. So at NIPRID, one of the things we did was starting to look at how we can put forward our resources to ensure that if it gets here, we won't be facing those kind of disruptions. And I think it was shortly after the 27th of February when COVID-19 finally hit our shores that we presented our concept product development of a sanitizer to the Minister of Health. And he directed that we very quickly get a NAFDAC registration and get that product out there. That has been done. The NIPRID sanitizer, very high quality, highest international quality, is out there. Other things we did along that same line were to collate a database of other people who manufacture hand sanitizers, masks, PPEs, and other such commodities that would help disrupt the spread. And based on, collating the data and making it available, as well as sharing NIPRID's formula with other interested parties that wanted to start manufacturing hand sanitizers, we were able to avert the kind of disruptions that were seen in countries like America and other places in Europe. Now, coming to the interventions, so things like ventilators, things like disinfectant devices, again, these are areas where, it's clear to everyone that there's a global shortage of ventilators. You have countries scrambling over each other and seizing each other's consignments. Again, sister agencies, took the bull by the horn, and NASENI, who is a sister agency in the Federal Ministry of Science and Technology, developed a prototype, and which they've come to us to say, we have a prototype of this ventilator. How do we now validate this ventilator scientifically to make sure that it is safe for use in humans, as well as can contribute to addressing the coronavirus issue. So we're working with them to validate those ventilators, as well as supporting their disinfectant devices. Furthermore, things like clinical trials. NIPRID has also developed concept notes and protocols for undertaking clinical studies. Now, this is interesting because what we've done is we've developed these particular proposals both for conventional medicine as well as for medicines that have phytomedicinal origin. And our concepts that have underpinned the development of these proposals are of the highest international standards. Having said that, going back to the earlier point I was making, which is about the clinical trials. So for the conventional clinical trials, we already signed a memorandum of understanding with the University of Abuja Teaching Hospital. Professor Ekele and myself, alongside my team, have had several meetings as regards putting this particular clinical trial protocol through and getting a good body of evidence that supports the interventions that are used in Nigeria. For the other clinical study that we're talking about, unfortunately, there hasn't been enough interest as regards funding and as regards partnership. that will enable us move it forward to the next stage. But we're still very hopeful that people will come on board, and that will also kick off.